Hello everyone, Sat Shri Akal. This is Dr. Sukhbir Kaur from Hong Kong, and today I want to talk about the power of human brain and some of practices in medicine which could have great impact on patient health. Well, all the medical professionals are well versed with the terms the placebo effect and behavior modifications, and how does it affect the human brain. To be precise here, human brain is powerful healing tool if given the chance. The idea that our brain can convince our body that this particular treatment is a real thing and thus stimulate healing can be as effective as conventional treatments. The placebo is more than positive thinking, believing a treatment or procedure will work. It is about creating a stronger connection between body, the brain, and how they work together. It involves complex neurobiological reactions that includes everything from increase in feel good neurotransmitters like endorphins and dopamine for creating activity in certain brain regions. So basically, four factors are involved. Firstly, expectation and conditioning. Secondly, the human brain. Third factor is evolved health regulation, which shows that body of a mammal has developed helpful physiological response to pathogens. For instance, fever helps removing bacteria and viruses by raising internal temperature. The evolved health regulation theory suggests that a strong belief in medication or intervention might relieve symptoms. Fourth, and very important factor being psychoneuroimmunology. Psychoneuroimmunology is a relatively new area of scientific studies. It studies direct effect of brain activity on the immune system. The pathways by which the brain impacts the immune system are complex, but expecting improvement in health can impact the efficacy of individual's immune system. In other words, a positive outlook can help stave off illness. So, the positive outlook is the key here, which simply means that we need to treat the psychology of the patient along with physiological and pathological treatment. I have mentioned placebo effect here, not for any clinical trials or anything that sort, but just to signify the power of human mind and how can it make any treatment much more effective. Now, why am I relating it to COVID-19 epidemic situation? In other simple words, what is happening is that too much fear for COVID-19 has created negative impact in most population around. And once any person is getting infected, the fear and panic increases and it is precipitated more when they reach hospitals. Since now patients have social awareness that and they know that the worst scenario is that currently there is no treatment or vaccine available for this infection. And moreover, they are worried about their family members and have mind set up that maybe they cannot see their family again. So there is negativity going on in patient mind and this could deteriorate their health even more. Now, maybe a person would only have mild symptoms, but due to fear and negativity in mind, the symptoms get worsen. So, my point of view is that doctors need to treat the psychological aspect of disease along with the pathological and physiological treatment. I understand frontline doctors are doing great jobs. It's not easy to cope up with increasing patient load. But what I am trying to say is that we are directly or indirectly depending on patient's immune system. And we want immune response to be triggered to this level that it can fight off the infection. And hence patient can improve. Now the point is that immune response is most efficient when the patient is confident and relaxed. Though it is difficult, but it can be achieved by taking patient in confidence, by using simple words like you are in right hands, you will be fine, your family is fine, and you will see them soon. By having confidence in your voice and telling them, we have got the treatment for you, and you will recover in no time. By saying, you are responding to treatment very well, and hence boosting patients' confidence. So, whatever treatment we are doing, whether it's antiviral medication, endotracheal intubation, or anything else, if the patient is confident, things will work in right direction. Firstly, patient with mild symptoms will recover very quickly. Secondly, if patients under breathing issues, there are chances that patient own will to fight against infection becomes extremely strong and hence positive outcome can be achieved. So what is required here is that doctor and patients communication need to be enhanced. We need to take the patient in confidence. For that, along with frontline medical and surgical staff, there could be a team of psychological experts who can just boost a patient's morale. Along with this, some physiological sessions, light music therapies can make the environment of the hospital a bit lighter. So basically, we need to make positive environment for patient in hospitals if we want positive outcome. And yes, one point to mention here is that doctors can feel confident to attend patient closely if they have adequate personal protective equipment. And here is a message for people worldwide. Please think positive because if you think positive, you can fight off any situation or cope up with any illness. Thank you.